Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hey, friends, and welcome back to the Friendly Pharmacist podcast from Cantu's Pharmacy. I'm your host, Nario Cantu. Around here, we believe healthcare should feel like a conversation at your neighborhood counter, warm, practical, and always focused on helping you live well. Today, we're digging into something close to my heart, Pharmacist-Led Clinics. What they are, how they work, and why they are becoming one of the most effective, accessible ways to manage everyday health conditions. So what is a pharmacist-led clinic? Think of it as a focused service inside or sometimes alongside your local pharmacy, where a pharmacist works with you on a specific health need. It's care that's hands-on, protocol-driven, and collaborative with your primary care provider. We're not replacing your doctor. We're extending your care team, filling the gaps between appointments, and making it easier to act on the plan you already have. Depending on your state's laws, these clinics may operate under collaborative practice agreements with local providers or as protocol-based services with clear guardrails. Either way, the foundation is the same: accessible expertise, frequent touch points, and coaching that turns "I know what to do" into "I'm actually doing it." So why do they matter? Because most health wins don't happen in a 15-minute office visit. They happen in the day-to-day, in your kitchen, at your pharmacy counter, and on your phone at 7 p.m. when you're wondering, is this the right dose? Is this inhaler working? What do I do next? Pharmacist-led clinics turn those everyday moments into progress. Here's how. Access and convenience, no month-long wait list. We live where you live. Medication mastery, we're the medication experts. We sort out interactions, timing, side effects, and costs. Frequent follow-ups, small, regular check-ins beat once-a-year resolutions. Personalized coaching, we translate your plan into your lifestyle, your budget, your schedule, and your language. Teamwork, we document, share updates with your provider, and refer when something's outside our lane. So what kinds of clinics are we talking about? Let me walk you through a few common pharmacist-led services and what a visit might look like. 1. Diabetes care and continuous glucose coaching. You come in or connect by telehealth for an initial assessment. We review meds, look at glucose patterns or CGM data, check supplies, and set 1 or 2 realistic goals. Maybe adjusting timing of your metformin with meals, fine-tuning insulin technique, or building a snack plan that won't spike your readings. We follow up every 2 weeks, coordinate labs with your provider, and help with prior auths and affordability. It's practical, doable, and it sticks. 2. Blood pressure and heart health. You bring a home BP cuff, or we help you pick one. We validate the device, teach proper technique, and build a routine that fits your mornings. We review meds like ACE inhibitors, diuretics, and calcium channel blockers for side effects and timing. We track readings, adjust lifestyle goals, and send summaries to your provider so changes are made with confidence. Asthma and COPD inhaler optimization. Most inhalers fail not because the medicine is wrong, but because the technique is off. In clinic, we do a full inhaler check, device training, spacer use, trigger avoidance, and an action plan for flare-ups. We also look at adherence apps and refill timing, so you're never stuck on a Friday night without your controller inhaler. 4. Anticoagulation and blood thinner support. Warfarin, apixaban, rivaroxaban, each has its own rules. We counsel on diet, interactions, surgery prep, and missed doses. If you're on warfarin, we can coordinate INR testing. If you're on a DOAC, we focus on kidney function checks, adherence, and procedural planning with your specialists. 5. Immunizations and preventive health. We plan your vaccine schedule, flu, COVID-19, pneumonia, shingles, RSV, travel vaccines. So it's not a guessing game. Preventive care is where pharmacists shine because we can screen and act in one stop. 6. Minor ailments and test to treat. Sore throat, we can perform CLIA-waive tests for strep, flu, and COVID-19 where allowed. And under protocol or collaborative agreements, we can treat or coordinate a same-day prescription. Fast answers mean faster relief. 7. Women's health and family planning, state-dependent. In many states, pharmacists can prescribe contraception, offer UTI assessment and treatment under protocol, and screen for things like emergency contraception needs. Always link back to your primary care. 8. Smoking cessation and weight management. We combine meds that work, like varenicline or nicotine replacement, and when appropriate, weight management therapies with behavioral coaching, meal planning tips, and follow-through. It's not a lecture, it's a plan. 9. MedSync, deprescribing, and polypharmacy. If your pill box looks like a puzzle, we'll simplify it. We line up refills, look for unnecessary overlaps, and work with your provider to deprescribe when the risks outweigh the benefits. What does a visit feel like? Relaxed and focused. You'll notice 3 things. We listen first. Your goals guide the plan. We measure what matters. Glucose logs, BP readings, symptom journals, inhaler use. We make data simple. We remove friction. Prior authorizations, coupons, delivery, sync. Our job is to lower the hurdles so you can focus on getting better. And privacy? Absolutely. We follow HIPAA, use private areas for consults, and document securely. The experience is personal, not public. Who benefits? Patients, better control, fewer side effects, and a care plan that finally fits real life. Providers, we close care gaps, track adherence, and surface issues early so office visits can focus on decisions, not detective work. Caregivers, clear instructions, a single point of contact, and less guesswork. The community, more immunizations, fewer urgent care visits for minor issues, and faster access to trusted guidance. Can pharmacists prescribe? Great question, and it depends on the state and the specific service. Here's the simple version. We work within clearly defined protocols and collaborate with your provider. When we can initiate or adjust therapy, it's because your state allows it and we have the structure to do it safely. When something needs a physician's touch, we refer right away. Safety and teamwork aren't negotiable. How do I pay for it? Again, it varies by service and state. Some clinics are covered under medical or pharmacy benefits, others are cash pay with transparent pricing. Vaccines and point-of-care tests are often covered. We'll tell you up front what to expect and never surprise you. A quick story. A patient, we'll call her Maria, came in worn out by swinging blood sugars. She knew the basics but felt stuck. Over 8 weeks, we tweaked the timing of her meds, switched to a CGM she could actually afford, and mapped out 3 breakfasts that didn't send her numbers soaring. We coordinated with her provider on a small medication adjustment. 3 months later, she wasn't chasing highs and lows. She was living her life. That's the power of frequent, focused support. How we keep it safe and high quality. Evidence-based protocols. Clear documentation and secure communication with your provider. Guardrails for when to adjust, when to pause, and when to refer. Training and certification for specialized services like immunizations, diabetes education, and smoking cessation. Quality checks, we audit outcomes and patient satisfaction so we keep improving. What to do next? If any of this hits home, if you want steadier blood pressure, fewer asthma flare-ups, better glucose control, help quitting tobacco, or a simpler medication routine, start with a conversation. Call us, stop by the counter, or look for the clinics page on our website. We'll match you with the right service, explain costs, and schedule a time that works. Bring your medication list, your device logs if you have them, and your questions. We'll bring the coffee and a plan that makes sense. At Cantu's Pharmacy, our mission is simple: make better health easier. Pharmacist-led clinics are one of the best tools we have to do exactly that. Right here in the neighborhood with people who know your name. If you found today's episode helpful, share with a friend, subscribe, and leave a review so others can find us. And as always, if you have a topic you want me to cover, send it our way. We love hearing from you. Until next time, I'm Nario Cantu. Stay well, stay curious, and remember, your friendly pharmacist is in your corner.